Hello and welcome everyone to this webinar from the Public Health Law Center. We're so happy to have you join us today to talk about cooking with smoke, how the gas industry used tobacco tactics to cover up the harms from gas stoves. I'm Joelle Lester. I'm the Executive Director at the Public Health Law Center, and I'm joined by my colleague, Jamie Long, who is a Senior Staff Attorney with our Climate Justice Program, providing legal technical assistance to climate and public health professionals and advocates seeking to protect health through the power of law and policy. We are based at Mitchell-Hamline School of Law in St. Paul, Minnesota, but we work all around the world. I will say St. Paul, Minnesota is on the traditional homelands of the Dakota people. This is our team. We have many attorneys working to help communities protect health in the areas of commercial tobacco, healthy food and physical activity, tribal public health policy, and climate justice. So in all that we do, we seek to improve health through the power of law. We do this through legal technical assistance, which just means legal research and writing. We develop publications, trainings like this, and webinars. And then we also provide individualized legal information and support to help community leaders and public health leaders develop policies that will best protect health that align with community priorities. In all of that work, we seek to center equity, which means designing policies that deliver the public health protections to every member of a community, so that not everyone needs the same resources and protections, but everyone deserves all of the resources and protections that they need to achieve a full, healthy life. So just a little overview for our program today. So we are lawyers and policy analysts here at the Public Health Law Center, and we're trying to think about how to design policies that use a jurisdiction's authority and relies on evidence to best protect health. And part of doing that effectively requires understanding the industries that are driving the health harms. And so we're focused today on what these tobacco and gas industries knew and when they knew it, and how they behaved in ways that prevented an effective public health response initially. And we think it's really important for folks to see what the industries are up to, because it helps us understand what we have to do as public health professionals and climate justice advocates to ensure that we are designing and implementing and enforcing effective policy solutions. So we're going to get started with Jamie talking about the health harms from burning tobacco and gas. And then I'm going to talk a little bit about what the industries knew and how they operated to cover up and deceive the public about the health harms of their products. And then Jamie's going to bring us home by talking a little bit about policy solutions that are available. I will say that big tobacco, in addition to developing and selling the most deadly consumer product in history, the other terrible consequence of big tobacco has been that it developed the playbook that other industries have followed to place profit over human health and environmental health. And so it's really important that we understand when an industry is operating the same as big tobacco so we can respond effectively. And with that, I'll turn it over to you, Jamie.
So much, Joelle. So going to start off by talking about gas appliances and the health harms and how those also overlap with the harms that we've seen from tobacco. There's been research available for decades on the health impacts of gas appliances, particularly gas stoves, but this is only recently coming into public consciousness. And the Public Health Law Center is trying to do our part. We just released a publication that we are going to be covering some of the content from that publication in the webinar today called Cooking with Smoke, to try to highlight these overlapping health harms between gas and tobacco products, and then also to talk about the tactics the industry is using. So this is a comparison of some of the health harms from both gas stove pollution and cigarette smoke. And it was really striking to us, even as an organization that has been working in tobacco space for decades, how many pollutants are overlapping between the two products. So there's nitrogen dioxide, carbon monoxide, benzene, particulate matter, and formaldehyde. We'll talk about the health impacts of each of these. So they're not the same. There are some heavy metals that are produced by cigarette smoke, but there is a really striking amount of similarity in terms of the health harms and pollutants that are coming from both products. To talk through some of these health harms, we'll start with three. So nitrogen dioxide is a byproduct of combustion, and this contributes to increased asthma attacks, to inflammation of the airways, worsened cough and wheezing, and reduced lung function. The EPA identifies both gas stoves and tobacco smoke as among the primary sources of indoor NO2 exposure. EPA does regulate NO2 outdoors, but there's no federal limit right now for indoor exposure. Carbon monoxide is produced by the incomplete burn of gas, and gas appliances are the first listed source of carbon monoxide by the American Lung Association, but cigarettes also produce carbon monoxide as a byproduct. 170 people die every year from carbon monoxide poisoning from sources like stoves and ovens, but 95% of carbon monoxide poisonings are non-fatal, and these are lower level, often chronic exposures that are harmful to human health and are not always captured by a standard carbon monoxide detector, which is designed to be a life-saving device. Benzene is a known carcinogen for which there is no safe level according to the World Health Organization. The American Lung Association cites both tobacco smoke and gas stoves as sources of benzene. And for gas stoves, benzene is found in the unburned gas that leaks from the stoves. So to talk a little bit about each of these in turn. So for nitrogen dioxide, the largest risks we see in this space are from the exposure to kids. And that's because kids are more susceptible to nitrogen dioxide pollution. They have higher lung surface to body weight ratio. They have less mature respiratory systems. They are breathing more regularly, and they do so at a lower level, closer to the ground. And when you combine all of this, in a 2013 study, they found a 42% increased risk of asthma symptoms for kids in homes with gas stoves. There was a study also published last December that found a 12.7% of childhood asthma cases in the United States as a whole can be attributed to gas stove use. And these studies also show that there's a similar risk to asthma for kids of living with a smoker and living with a gas stove. We also know that these risks are not evenly distributed. We often hear from the industry that ventilation is the cure. If you vent your gas stove, then there won't be health harms. One of the challenges, though, is that ventilation, although important, is not universally required. And ventilation also reduces, but does not eliminate pollution. We also know that ventilation isn't evenly distributed. Older homes often have inadequate or no ventilation or aren't venting outdoors. We also know that in lower income households, they often have smaller unit sizes, more people per room, and greater asthma burden overall, both from the other environmental pollutants that they're being exposed to and the cumulative burdens from environmental racism, from higher exposure to outdoor pollutants. We also know that often, unfortunately, in cold climates, many families use stoves or ovens for supplemental heat, which also contributes to increased NO2 pollution. Turn to benzene, so as a reminder for gas stoves, benzene comes from leaks, so from unburned gas. And in a California study in 2022, they found that gas leakage from stoves and ovens can result in indoor benzene concentrations that are comparable to secondhand tobacco smoke, and that these exceed health standards. In a 2023 study from Stanford University, they found benzene in every single stove they tested across California. And they found that for 45 minutes of a burner or an oven at over 350 degrees, that would exceed health standards, and that the benzene levels they measured exceeded secondhand smoke levels in some cases. To talk about two additional other health harms and pollutants that are shared between tobacco and gas. Particulate matter is produced by burning fossil fuels and by burning tobacco, and it contributes to serious health harms, including cardiovascular disease, respiratory disease, and lung cancer. The industry likes to point out that cooking food also produces some particulate matter emissions, but gas stoves emit particulate pollution even without cooking food. and particulate matter pollution from cooking food on gas stoves can be twice as high as from electric stoves. And finally, formaldehyde is a volatile organic compound and a known carcinogen that's released by both tobacco and gas pollution. So all of this evidence has not been unnoticed by health organizations. This has led to many medical associations issuing warnings to the public in recent years. The American Medical Association had a resolution in 2022 where they said use of a gas stove increases household air pollution and the risk of childhood asthma and asthma severity. The American Lung Association also did a literature review that they released in 2022, and they said that evidence is strong that long-term exposure to ambient particulate matter, ambient ozone, and household air pollution contributes to premature mortality and increased risk of illness. The American Public Health Association and also some health associations abroad, like Asthma Australia, have also drawn the connections between health harms and tobacco smoke. So with that, I'll turn it back to Joelle to talk about the industry cover-ups.
Great. Thank you, Jamie. So now that we know about some of the startling similarities between the products and the harms, it's time to talk a little bit about how the industry behavior also aligns. So as I mentioned at the top of the hour, the Public Health Law Center does work in commercial tobacco prevention, and we have worked in that space for 24 years. And so we know a lot about the history of the tobacco industry and have been part of this movement. And so we think it's a really instructive perspective to share when we're talking about regulating gas. So with tobacco, you might be aware that although the government and the public didn't start learning about the cancer linkages and other health harms from smoking cigarettes until later, the industry knew about it decades before. So as early as 1928, that smoking caused cancer. And then we know from the internal documents from the tobacco companies that they were openly acknowledging that internally as early as the 60s. And similarly, the gas industry has its own researchers that have been studying and trying to understand the health impacts from gas appliances since the 70s. And by the 80s, the industry knew about the indoor air pollution harms caused by gas appliances and gas stoves in particular. I do just want to give a little shout out to researchers and folks on whose materials we have relied to deepen our understanding and connect it to policy change. That as lawyers, we develop little researcher crushes on the folks who toil in the case of tobacco, often in the Tobacco Industry Documents Archive that's housed at UCSF. And that work is so important and so helpful to inform and improve our policy work. Similarly, we have some information from R.J. Reynolds, scientist from the early 1960s, showing the connection with lung cancer and also specifically causal. And so you'll notice that the language in this internal quote is very different from how the tobacco industry talked about its products publicly, where it focuses more on trying to create a sense that their information is not conclusive. But they definitely understood it the entire time. And then similarly, there was an American Gas Association executive in 2020 acknowledging the generation of contaminants and as he said, it's not going to be easy to paper over because it's just a fact of the products. So we know that they've been aware and that they have been studying it themselves, and then how they present information publicly is very different. So just to give a little rundown of the tobacco industry playbook and how closely the gas industry is hewing to those tactics. Both industries have launched misleading public relations campaigns. They both fund their own research that is biased and intended to create a sense that there's uncertainty or doubt about the health harms of their products where they know there is none. They have avoided safer product design that could reduce the health harms. They have funded front groups and in astroturfing, so trying to create a sense that there's a broader public or grassroots support for their companies and their products, but actually it's all just funded by the companies themselves. They have both, alarmingly, tried to exploit legitimate racial justice issues to drive racial wedges in the public for support of their products versus supporting regulation to protect health. They both have used preemption of local policy change authority as a tactic to avoid regulation. And then they both use litigation, suing local governments over local policies, both to chill policy change because it's expensive and intimidating to local governments to be sued by big companies, but then also trying to overturn the regulations themselves or the ordinances themselves. So let's go a little bit deeper into a couple of these examples. So the public relations campaigns and marketing to kids and young people, the tobacco industry, we have a lot of great images from the tobacco industry, and it's you can see the strategies and patterns in their efforts to market their products to young people and to minimize any potential health harms of their products. This image is from the Stanford University research into the impact of tobacco advertising. If you haven't checked out their incredible archive of tobacco industry ads, I highly recommend it. And on the right, you can see this is actually a coloring book, Natural Gas, Your Invisible Friend. So you can just see the ways that the industries try to make themselves seem harmless, I guess, and creating these products even for children. And interestingly, both big tobacco and gas companies have used the same PR firms. So it's not just the same tactics, it's sometimes the same people. As uncovered by the Climate Investigation Center, Hill and Knowlton executives who had formerly worked for tobacco accounts were also on contract with the American Gas Association. Funding the bias research. This is a really foundational tactic from big tobacco. As I mentioned, they had front groups. They would cooperate with each other or conspire with each other big tobacco companies, to try to push out misleading science or just a generation of a feeling of doubt. And Merchants of Doubt is an excellent book you should definitely read if you want to understand how these companies try to thwart the development of legitimate science and public understanding of that science to avoid regulation. There's also a documentary by the same name that I highly recommend. But again, it's often the very same people. According to a 2023 New York Times expose, the American Gas Association and gas utilities have used toxicologist hired gun, Julie Goodman, to cast doubt on health concerns related to gas. She appeared at a public hearing on regulating gas stoves in Multnomah County out in Oregon, where the city of Portland is, to downplay health concerns from gas use, but she didn't disclose that she was being paid to testify by the gas utility. She was also hired by the American Gas Association to go after the AMA, as Jamie mentioned, over its 2022 resolution that concluded that gas stoves are a health hazard. And then both of the industries strenuously avoid a safer product design. So there's a lot of examples of this from the tobacco industry, of course. And I'm going to just drop a couple of links to articles. Oops, I have to make sure I send it to all of you, not just to Jamie. So the addition of filters to cigarettes was done to try. Initially, the companies were open to actually making their products less harmful, but eventually they realized that they weren't making them less harmful. And so instead, what they just wanted to do was create the perception that filters make cigarettes less harmful for your health. So they were very clear, and there are internal company documents that show this. They understood that filters not only weren't making cigarettes less harmful, but that they were, in some cases, introducing new health harms. For example, sometimes the filter material would shed itself, and the smoker would inhale. The person who was smoking would inhale that the shards of the material, and that introduced other problems and different kinds of lung cancer actually resulted from filtered cigarettes. Filtered cigarettes are also terrible because it introduces more plastic into the cigarette butts that are the most littered consumer product in the world. And so the industry knew this all the time, but they continued to promote the products. And this ad that I included here is just interesting because it's showing that it says by U.S. government testing, it shows that it's reduced nicotine. But they knew that the machines that the government used to test the emissions from the product were different from how people actually smoke the product. And so they had little holes in the side of the filter that they knew the smokers' fingers would cover up when they were using the product, and therefore reducing any potential effectiveness of the filter as well. So again, it's all about what they knew, how they knew it. They could have done other things to reduce the harm of the product, and they have just completely refused and resisted at every turn all public health regulation of their products. Turning to gas stoves, similarly, the gas companies did look into alternative versions of their products that could have had less harmful health impacts. So, for example, they developed infrared stoves in the 1980s that emitted 40% less nitrous oxide, but the stoves were never manufactured, partly due to cost, and then also because this kind of stove dramatically reduced the blue flame, which the industry had already spent a lot of time and money marketing as its signature visual. And so they decided that protecting health was not as important as having that blue flame, which they had promoted as part of the experience of using gas stoves. So pretty appalling behavior. Another tactic that both industries use is the use of front groups and then driving racial wedges. So the use of front groups is sometimes just having a more benign sounding organization that they are funding. And that was a big tactic of the tobacco industry a few decades ago. More recently, the tobacco industry will have a different organization sue over an ordinance. So, for example, they will have a group of retailers sue to challenge let's say, a flavored tobacco product sales restriction in a jurisdiction because they don't want to seem like the puppeteer pulling the strings, even though they are. But the other big issue, and this is really, really present right now in tobacco policy change, is the industry takes a very legitimate racial justice issue and tries to exploit it and subvert those arguments in service of its own profit. And so it's happening right now, week in and week out. The tobacco industry has been trying to drive a narrative that getting menthol cigarettes off the market would harm African Americans because it would put them at greater risk of police violence. And they have been funding spokespeople, including the Reverend Al Sharpton, to carry this message for them. Former NAACP President Ben Chavis has also been really involved on behalf of R.J. Reynolds and other tobacco interests. And it's really terrible. It's really upsetting that basically what they're saying is they should be allowed to kill more African Americans rather than just dealing with both problems. Of course, police violence against African Americans in this country is a huge problem. It's a civil rights issue and it's a public health issue, and it needs to be addressed. But it doesn't mean we have to allow tobacco companies to prey on African Americans as they have for more than a century by letting them continue to sell menthol cigarettes. So it's a very upsetting and offensive approach. And the gas industry is doing exactly the same thing, sometimes with the same spokespeople. So, for example, Al Sharpton invited methane representatives to his organization is called the National Action Network to speak to the organization and spread disinformation. This story talks about attendees being falsely told that methane gas is clean, and that they were also told that expanding methane gas and access to methane gas is a civil rights issue. And then finally, the tactic of preemption and two tactics, preemption and litigation. So preemption is just, you probably are aware of this, but it's just the situation where the federal government and federal laws have priority over state in most cases. I'm not going to give you a whole primer on preemption, but you can't usually conflict with a federal law as a state, and then the local authority for states comes from the state, and so the local authority for municipalities relies on state delegation of authority, and so the state can prevent local communities from doing something, and the federal government often can prevent states and locals from doing something. And so the tobacco industry has really used this to try to avoid having local governments pass protective policies. Again, we have it from their own mouths, that they are trying to preempt local tobacco control policies in all 50 states. And the reasons for this is it's easier for them to focus on the federal government than to try to influence government at all levels. But also, a local policymaker is a lot more connected to their community, and it's a lot harder for them to ignore the impact of a policy than it is from a more remote policymaking perspective. And so it's harder for the tobacco industry to buy off all the local policymakers. And it's definitely a lot less convenient because there's so many of them. And we've seen that the gas industry has also, this is a tactic that many industries have tried to pursue to protect their profit margins from effective policy change at the local level. But you can see here for the gas industry, this map shows the state and local restrictions on natural gas use in buildings and bills to prohibit gas bans, and how that's a national strategy by gas companies to try to avoid having public health policies infringe on their product sales. And then the litigation, I will just mention again, because we have seen litigation challenging, of course, the tobacco industry is super litigious and is always suing communities. And as I mentioned before, it doesn't actually matter that much to them whether they're going to win all the time. It's the fact of the lawsuit can be helpful to the tobacco industry, because they have basically unlimited resources and funding to keep suing. And local jurisdictions don't have unlimited resources. And it's very upsetting sometimes to be sued. It's expensive to defend against a lawsuit. And so the tobacco industry has used this as a tactic to chill policy change. And we've seen that also with gas companies. So, for example, there was a local ordinance in Berkeley to prevent new construction using natural gas and requiring electrification to protect health. And the gas companies sued, or Front Group actually, I believe, sued, and they won. They were able to say that local ordinance was preempted by federal law, which we think is a bad take. And we have information about that on our website if you're interested in checking that out. But these are just examples of how closely the gas industry has followed the tobacco industry's lead in sticking with harmful, unhealthy product design at all costs, and trying to mislead the public, spread disinformation, and prevent local policy change in service of its own profit margins in a pretty flawed business model. So with that, I'll turn it back over to you, Jamie.
Thanks, Joelle. So I'm going to cover some of the policy options briefly that are available and that the Public Health Law Center is pursuing and assisting others with. So first, I'll mention a petition that we filed with HUD, the Department of Housing and Urban Development, in October 2022 to phase out gas appliances. We targeted HUD in particular because public housing, we know, is, if you're thinking back to the nitrogen dioxide disparate impacts slide, we know that lower income households in particular are seeing a higher pollution burden from the use of gas stove, have poorer ventilation, and the other factors that lead to them having a higher pollution burden overall. And so we wanted to start with the communities that were most impacted as we were looking to help phase out gas stoves. And HUD has obligations to the public housing residents that they be free of hazardous materials and toxic chemicals and gases. We walk through the evidence of the toxicity of gases and chemicals that are coming from gas stoves, and also to provide decent, safe, sanitary, and in good repair housing. And you can see the organizations that signed on to the petition. We are still working with HUD to try to get a response and to try to make sure that we are able to have HUD take meaningful action to help protect public housing residents. But this is one area where we have been active. We're also working with local and state jurisdictions that want to set building performance standards. So building performance standards set targets for existing buildings to reduce energy use or to reduce greenhouse gas emissions by set deadlines. There are 4 states so far that have moved forward with building performance standards, and 8 cities and counties that have as well. So just to give one example from Denver, their building performance standard covers buildings that are over 25,000 square feet, with some exemptions for manufacturing business buildings or for low occupancy buildings. And they set a maximum site energy use intensity by building type that the buildings have to meet within that type, and they have compliance every 3 years. So that's an example of one approach to help move towards reducing the pollutant burden from stoves. And then there are also a number of electrification policy options, and I won't spend too much time on each of these, but just to highlight some of the examples. So one is requiring new construction to be all electric, and we have nearly 100 cities that have done this so far. Unfortunately, there's also been a backlash, which Joelle highlighted in the preemption slide. That map showed the states where there has been preemption at the state level from moving forward with all electric new construction. And we also, as Joelle mentioned, have seen some litigation in this space in the Ninth Circuit and elsewhere on some of these requirements. So that's an area where we are ready to help if a local jurisdiction wants to move forward and has questions about what the state would allow in their jurisdiction, and also questions about what a decision in the Ninth Circuit might mean. If you're outside of the Ninth Circuit, we're happy to help in that area. Another policy option is updated building codes. And so these can be prescriptive, where you have various prescribed options to meet an energy efficiency score, or performance requirements, where you can combine different scores to get to the required performance. And we've seen many efforts to move forward with building codes. There are preemption questions from the Energy Policy and Conservation Act at the federal level with building codes. And those are areas that we're also happy to help local jurisdictions think through and work through. Clean heat standards is another option where you are able to have essentially a cap and trade mechanism for building heating. So you could count things like district energy or electrification towards a clean heat approach. Targeting air emissions is another innovative approach that some jurisdictions have used, including New York City, where they have an ordinance that limits carbon dioxide emissions from new buildings. So this wouldn't be viewed as a building code and would be squarely within the air emissions authority and jurisdiction in New York City. There's also been some efforts to target new gas infrastructure, so the building out of additional gas infrastructure, or trying to have certain communities roll back gas infrastructure. So these are a number of different approaches. Each of them have their own legal questions and nuances depending on the jurisdictions and the state laws that are involved. But certainly lots of options remain for local and state jurisdictions to pursue building electrification. We've also seen that this is picking up quite a bit. The U.S. Climate Alliance, which is a coalition of governors committed to moving forward dramatically in building performance standards and new building codes, and clean heat standards, and some of the other areas of policy that was described before. So we are seeing a lot of activity in this space, which is very promising. So before we turn it over to questions, just wanted to remind folks that we're here to help. So there are questions that are active on preemption. in the space of the building electrification policy work, both preemption at the federal level with Energy Policy Conservation Act and at the state level. We also are able to help address policy options in various jurisdictions and to provide legal technical assistance on ordinance design. We hope too that the content of this presentation in terms of thinking through the overlapping interests of the tobacco industry and the gas industry, the shared tactics, the shared deception, and the shared pollution creates a narrative that could be helpful for local ordinances. We know that there are only now many in the public who are becoming aware of the harms from gas stoves and having the information about the overlap with tobacco pollution, we hope can make this more understandable to the public. We also hope that this can help with findings for local jurisdictions, for example, when they're putting together an ordinance to show a rationale, health-based rationale for moving forward, and also public policy rationale, given that industries are covering up the harms from their products. And we hope that this is a helpful public framing too for those conversations that are happening and playing out in particular jurisdictions. So with that, I think we will turn it over to questions and answers, and I'll have turn it back to Joelle.
Great, thank you, Jamie. All right, we have some questions in the queue already, and I would just encourage folks to go ahead and keep adding questions. We wanted to leave a lot of time for some conversation here. So, Jamie, this one actually came in from the registration. How do we combat the social license of gas stoves? For example, the general public perception that they are better for cooking, more efficient, that kind of thing.
Well, that's a great question. Well, I think the first is on the technology side, that there is, I think, some misperception about what an electric stove is. Sometimes people think about the old coil stoves, which were not good technologies, right? Those were certainly inferior products. But now we have both like glass top electric stoves, which are certainly as good as gas stoves, and we have induction stoves, which are better than gas stoves because they are cleaner technologies, easier to clean up. They're very efficient. They're very fast. And so we know now that there are products on the market that are superior in design. And I think helping folks understand that they have better choices is one way to move forward. But then on the social license question, I think more broadly, we know that it is important for the public to have a better understanding of what the harms are. I certainly know that as folks when I go out and talk to people about this, and they have more awareness of what the harms are, they say, "Oh my gosh, I got to do something about it," right? And so I think as people are seeing the increased press coverage of some of these harms, that can help with removing the social license. We also hope too that the tobacco narrative can be a way to help remove that social license, because we know that people have a deep understanding of what the harms are from the tobacco industry and what the health pollution harms are. And the research is very compelling that the health harms are very similar as we walk through. I think of the statistic that sticks out to me most is the similar asthma risk to a kid of living with a smoker or having a gas stove in the house. I think statistics and facts like that can be really compelling to families and those with kids and try to help remove that social license.
Definitely. I would add that the gas industry has sometimes used celebrity chef endorsements or that kind of thing to normalize their product and make it seem like the best option for serious home cooks. And of course, the tobacco industry has invested heavily in, they used to have doctors recommend different kinds of cigarettes and ads, and then also celebrity and movie placement and that kind of thing. So it's a very similar tactic. But also one of the biggest turning points for the social norm change or the denormalization of cigarette smoking came from the exposure of the industry's bad behavior when all of the internal documents were disclosed through litigation that actually stemmed from state lawsuits against the industry, and the Minnesota lawsuit was really important in helping push those documents into public view. But that's really what helped change how people thought about the product. And so, just echoing your point, Jamie, that understanding how the gas companies are following big tobacco's playbook and know about the harms and are trying to conceal those harms, like all of that information is also really important to help people think differently about these products. Another question is, how are health equity and environmental justice linked both by the industry and public health?
Absolutely. Well, I think we talked about some of the health equity harms in terms of there being a disproportionate burden on low-income households. And we also know that uh, in the HUD petition, we walked through in some detail what the differential burden is on people of color as well. And quite a bit of that is the cumulative impacts from folks who are living in the communities that already have industrial pollution in their communities, transportation pollution, increased risks of asthma to begin with. And then you add in gas stoves, often poorly ventilated, and that increases the burden on those communities. So that's one of the big reasons that we have been focusing our advocacy and effort on areas like public housing and on trying to reduce the overall harms from gas pollution in low-income communities first.
Absolutely. I think that that's another important reason why policy is required. You can't just incentivize the change. That doesn't always work for renters, as we have a question about that from somebody in the audience too. So you have to require these changes, and I just appreciate the focus of the HUD petition that you and other colleagues put together on delivering the protection to folks who are often left out of public health policy change. So on that note, renters, what are some things renters can do to improve the air quality in their home if they have a gas stove?
Yeah, so that's a tough question, right? If you're a renter, then oftentimes you don't have a choice about what appliance you have with you. So if you have a ventilation system, particularly one that vents outdoors, then the recommendation is to run the ventilation system on high and to cook on the back on the rear burners. So that's the advice, whether you're a renter or a homeowner. And that's not something that people do very often, but that is the advice. It's also advised to run your ventilation system when you are baking, which is also not something that's widely understood, but you are producing pollutants even when you're using the gas to just run the oven. So, unfortunately, those aren't always options. And so, most often, if you're in a rental situation, you don't have a ventilation system that vents outside. You probably have like a dispersion fan in the range. So, in that circumstance, the option would be to get a portable induction cooktop, and you can have a single burner. Those are actually pretty inexpensive. You do have to have pots and pans that are magnetic and can work with it, but that is an option that I know a lot of renters are able to pursue.
Great, thank you. And some specific information about that last option has been dropped in the chat by a very enthusiastic Lisa Cunningham. I don't know who she is, but she's keeping our chat lively today. Are there any laws specific to Minnesota that have been considered by this legislature?
So there have been there are proposals at the state level right now to have additional strengthening of building standards for residential, and there have been proposals as well to look at building performance standards at the state level in Minnesota.
Thank you. An apartment association just filed suit against Denver, Colorado for their electrification building codes. How does the Berkeley decision affect this? So maybe just getting at a little bit of the issue of federal circuits and when it controls and when it doesn't.
So I just saw that this lawsuit was filed, so I haven't had time personally to read it or dig into it. But Denver is not in the Ninth Circuit, so it would be a decision that they would look to, but it wouldn't be precedential. So I mean, it wouldn't be binding on the circuit that is reviewing the decision. But Daniel Carpenter Gold is able to help out our colleague. Uh, but the challenge is going to be, I think, a similar one. The arguments that we saw through the Ninth Circuit, and we have a very good blog post by Daniel on our website that talks through the Berkeley decision, why we believe it was wrongly decided, and I'm sure we will be making similar arguments in this case.
Yes, and I would just add that there's all is not lost with one bad court decision on federal preemption. As Jamie just said, other circuits could go in a different direction, and if there's a circuit split, that conflict would be resolved at the Supreme Court level. But also, Congress can clarify and preserve authority for local communities to act as well. So it's not set in stone, even though that was an unfortunate court decision. Next question. In addition to gas stoves, oh, wait a minute. Before we go to the next question, we have a surprise guest appearance by our colleague, Daniel Carpenter-Gold, who has been reading the Denver court case. Daniel, what would you like to say?
Can you all hear me?
Yes.
Okay, good. Yeah, sorry folks for coming in invisibly, but I'm not actually a panelist on this one, but I have been reading this case all morning and I'll just drop it, I'll just say on a quick read, like it's recycling some arguments from the CRA v. Berkeley case that just really aren't applicable. The Colorado and the Denver building performance standards are created in an entirely different way. They don't ban gas stoves. They don't ban gas appliances of any sort, and it's quite awkward trying to make that logic work. And then on top of that, as the panelists have already mentioned, there's the reasoning behind the Ninth Circuit decision. Judges in Colorado don't have to follow that, and for that matter, judges who are outside of the Ninth Circuit, so most of the country, do not have to follow it, and therefore even that case itself isn't applicable nationwide. But yeah, I'm sure we'll have more public to talk about publicly on that case as things progress.
Thank you, Daniel. So that was really helpful. And yes, we will, if you don't get our materials and you are curious to hear our summary of that case, once we get something useful put together, you can always sign up for our email newsletter that goes out just once a month and includes all of our new resources, and you won't miss the thing. Okay, next question. In addition to gas stoves, are there other appliances we should focus on to strengthen the public health argument toward electrification, Jamie?
It's a good question. So gas stoves is by far the most compelling because it is the appliance that is used indoors close to human habitation, and there's often not ventilation. But there are health concerns as well with using gas furnaces, in particular with some of the localized air pollution that can be contributed from the venting outside. And when you think about the cumulative impact of a number of these products that are venting outside, there certainly is a global warming impact from all of the methane and other pollutants that are being released from the burning of gas stoves from all appliances. So from an indoor air quality perspective, gas stoves is the most compelling. But when we're thinking globally, from regional issues and from the pollution from gas furnaces and also from the impact on global warming, there is an argument as well for other gas appliances.
Great, thank you. In the building electrification movement, is it more strategic to directly address gas stoves or to avoid them, since consumers are likely the most tied to them over other appliances?
So that's a very good question, and I think a good follow-up to the previous one. And so the health harm is really with the gas stoves from an indoor air quality standpoint. So that makes, from a public health argument, focusing on gas stoves to be the most compelling. From a greenhouse gas argument, any use of gas is compelling. And so at that level, you can talk about the need for electrification of other appliances, use of heat pumps or other technologies to displace electric furnaces, electric water heaters as well. You're correct that the gas stove is the appliance that people care most about. They don't particularly care about whether their furnace is gas or electric or whether their water heater is gas or electric. But unfortunately, the gas industry knows this too and has focused a lot, as we talked about, on marketing for the stove. And using deceptive campaigns like celebrity chefs trying to undermine cooking with electricity as something that is a compelling choice for individuals. So it does cut both ways. But I think if you're going to be making a public health argument, it's the strongest public health argument. And if we're moving towards electrification, you're going to have to eventually transition all appliances. So you might as well, make an argument for why we're transitioning gas stoves as well.
I also think that kind of a lesson learned in tobacco policy change too is that we have to think really comprehensively, because sometimes the industry pivots. If we over focus on one particular product that we're trying to restrict and don't think about how the industry might come up with some way around that or avoiding definitions, then we end up playing a game of whack-a-mole with an industry that is trying to hold on to its profits. All right. This person is asking about medical professionals talking about the harms of gas stoves and the similarities with smoking. They raise the example of it's a standard question by doctors to ask if anyone smokes in your home, but no one ever talks about gas stoves. Do you know? I mean, it's great that the American Medical Association has made a statement, but can you say more about that, Jamie?
I think this is a great question, and I think this is part of that awareness building that we need to continue to have. So the American Medical Association, American Lung Association, American Public Health Association having statements is really important. Those statements all kind of came in 2022 when you saw sort of the peak of coverage with the public and a growing understanding of this harm. So I think it'll probably take time to get to a place where doctors are also making that recommendation in an exam room. But the evidence is there, and there's certainly no reason why from a medical standpoint, they couldn't be making the same recommendation. So hopefully, as we're seeing increased statements, increased advocacy from medical associations, we can get to a place where we're seeing that more widely distributed in the public awareness and the communications with the medical profession.
Thank you. This question is asking us to talk more about how community and public support against big tobacco grew, and what lessons can we learn from that and apply towards the movement towards electrification. So maybe I'll talk a little bit about the history of that, but the shift in public perception around the tobacco industry broadly and the harms of cigarette smoking in particular took decades. And that is definitely because the public health advocates who were concerned were up against this really well-funded campaign of disinformation and deceit. And it made it very hard to establish, a public consensus, both a scientific consensus, but also just a public understanding consensus about the harms of tobacco products. And there were a couple of key resources towards pushing for dramatic change in how people viewed the products. And one was the series of U.S. Surgeon General's reports. So the U.S. Centers for Disease Control and Prevention and the Surgeon General have been really, really important thought leaders in our understanding of the science and making sure that there's a reliable, legitimate source of the science coming out where there's no conflict in who's funding it or no agenda that way. And so that started with the first one with Surgeon General Luther Terry in 1964, and that has continued. There's actually a Surgeon General's report about to come out. But so that was really important, having a trusted source of scientific information and evidence, and then also the litigation. And of course, as lawyers, we think the litigation is super interesting, but it was really important in the case of tobacco. But it couldn't be just individual lawsuits, because when individual smokers were suing big tobacco, they would just get buried, and they lost every time. And it wasn't really until a couple of big cases, the series of state cases filed by state attorneys general against big tobacco that resulted in the master settlement agreement that included 46 states and then 4 individual state settlements. That was super important. It produced a lot of money in damages to the states, but it also they secured some restrictions on marketing in that agreement that would have been difficult to do through legislation. And they also pushed all the internal documents where exposing the industry for what it knew and what it was lying about into the public view. And that was actually what finally shifted folks' understanding and Congress's willingness to act, because there was no federal regulation of tobacco up until that point. And then and with the exposure of the bad acts in the late 90s and early 2000s, they finally got the Family Smoking Prevention and Tobacco Control Act passed in 2009, which gave the FDA regulatory authority. So that sounds all very daunting, but I would say it's lawsuits, it's research, it's calling it out when and exposing the industry for the deception. Those are all really important to shift public perception of the products.
Just add to, I think using the bottom-up federal system has been an effective tool in the tobacco area as well. We saw cities leading the way on Tobacco 21, raising the age of tobacco sales to 21, and eventually that led to the federal government passing a law at that level. We've also seen efforts on flavored tobacco prohibitions that started at the local level and are now in conversation at the federal level. So I think you can see a similar tactic working in the gas space, where you have now 100 cities more working to try to pass local ordinances that are tackling building electrification and gas build out. And eventually, the hope is that will be enough to get to state level action and to federal action.
Absolutely. I would just add to that. That's such an important point, Jamie, and the local policy change does a couple of really important things beyond just protecting health in that community. It allows for the generation of evaluation of the policy to demonstrate its effectiveness in protecting health. And then it also gives courage to other jurisdictions and helps them think differently about what's possible. And absolutely agree, the locals will lead the way. The federal government is not going to be the big, bold thinker on these policy issues, so it will take local policy change. Let's see, since we need to change culture more quickly due to climate change, any thoughts on how we swiftly make these policy and cultural changes happen?
It's a great question. And I think part of what we're trying to help inspire is increase public awareness. We know that sometimes messages like this will cut through, where folks may have a public awareness of tobacco, and if they are able to associate that with gas in their minds, that can be something that can cut through. We've seen headlines in major newspapers about the linkages between gas smoke and or gas pollution and tobacco smoke. But it's going to take a lot of these efforts that we were just talking about, working at the local level. But we know that these can work. We've seen that work in the tobacco industry, where these efforts at a local level have turned into widespread action at the state and federal level. And we know it can happen here too.
Great. Then we just have one more question, which I know we're almost at time, but I want to take because it raises the important issue of concerns from rural residents who are hesitant to switch from gas stoves because they deal with frequent power outages, which is a very valid concern. Do you have any suggestions to market stove reforms specifically for rural communities?
It's a good question. I think it certainly can depend on what the local power makeup is for individual communities. Some communities are on a propane system. Propane can be pretty expensive, and so sometimes you can market moving towards electric as a way to reduce costs. So that's what they've done in Maine, where they've seen a huge shift over to heat pumps away from propane. But I know we're at time, so probably can't talk too much more.
Thank you so much, Jamie. And thanks everyone for joining us. We really appreciated having all of you with us today, and Stephanie will send out the recording and the slides sometime soon. So take good care. Bye.